We prepare for birth, we prepare for baby, but who prepares to hold you? Join me this week as I sit down with holistic OBGYN Dr. Jessica Vernon, and we talk about the perinatal mental health side of postpartum and its recovery. Hi, I'm Adrienne Irizarry. I'm an East Asian medicine practitioner who is passionate about women's health and helping women to live their best lives. My goal is to put you in the driver's seat of your health, offering holistic solutions for a symptom-free life.
Statements made in this program are for educational purposes only and not intended as a substitution for medical consultation or advice. We do not claim to diagnose, treat, or cure any diseases. This podcast is inclusive and welcomes all gender identities. The focus of the program is on biological function, and we will use the term women throughout, but it is referencing physiological and social challenges for biology, not identity. Come as you are, I am happy you're here and welcome all performances of identity. I hope you find something helpful in this show. Welcome back to another episode of the Reproductive Rebel podcast. I'm so excited to be joined today by Dr. Jessica Vernon. Welcome to the show.
Thank you so much for having me. This is such a pleasure to be here. And I know we've already been vibing on so many things before we're even getting started. So I can't wait to jump in with you.
I'm really excited. I am always really excited. Anybody who listens to the show on a regular basis, they're like, Adrienne, you're always really excited. And I am, because the coolest practitioners find me. And Dr. Vernon is absolutely no exception to that. So can you share a little bit with the listeners about who you are and what you do?
Of course. Yeah. So I'm an OBGYN by training. I practice and live in New York City, where I'm also a mom of two little human beings. And I'm also an author. I recently published my first book. As an OBGYN, I focus on holistic care and do a lot of work in perinatal mental health and emotional well-being. And I developed that passion after the birth of my first child, recovering from that experience and all of the struggles I faced when I felt so alone and felt like a failure, like maybe I wasn't meant to be a mom. So now I've kind of focused my practice a lot on that and work every day with patients. And the practice I'm in now is a midwifery-based collaborative care practice. And so the midwives are also amazing practitioners who really focus on treating the whole person and getting to know their patients. So we work really well together and kind of supporting people, not just physically, but mentally and emotionally as well.
I love that. So now you see why I'm excited, right? Because I feel like one of the top questions I see everywhere is, can somebody recommend a holistic OBGYN? And so when I had the opportunity in the screening calls ahead of this recording to sit down with Jessica, I was like, oh, you are the unicorn that so many of my clients are looking for. And as we got talking, I just really loved the fact that she stepped into this mental health space. One of the things that you touched on in your intro was that becoming a mother, there was this big, wow, I need support moment. And I feel like there are so many, especially first-time moms, that find themselves in the, wow, I didn't know what I didn't know.
Totally. And it took me a while to even know what was going on because no one really talks about everything that occurs postpartum in an honest way. And my training had not prepared me for all of the struggles that I faced. And I ended up with severe anxiety, depression, OCD that lasted almost 2 years before I hit my bottom and realized there was something going on, and then started to get the help and support I needed. And then after I got better, I was able to have the perspective and realize if someone like me with all of the privilege and resources and education and living in New York City where we have a million mental health providers could be struggling like that and not even realize it and feel so alone? What about everyone else who doesn't have any of that knowledge and resources available to them? So that really prompted me to educate myself more, get further training, and make sure that I could help support my patients in a better way.
I love that. I love that. And it's really true. Like, there's a lot of us that, myself included, I stepped into the work that I'm doing now. Yes, some of it came from my fertility journey and the birth
Mhm.
of my son. And a lot of it came from my first birthing experience. I
Okay.
had a beautiful pregnancy and a beautiful home birth with my first child. And then afterwards, I just was completely unprepared for how I was going to feel about my body and body image, how much support I physically was going to need. Because, I mean, when you go from feeling vibrant and strong and overall pretty healthy to the physically weakest you will probably ever feel in your
Mhm.
whole life after the birth of this human, and you still have to get up and nurse them or see to needs every couple of hours when you're in that state and you're physically that weak. There's a lot that starts to play in the mind,
Right.
and you wonder, like, did I do something wrong? Is it supposed to be like this? And then the fog on top of it all, you question everything, particularly as a first-time mom.
Right. And you're touching on that fact that a lot of this is a normal part of the transition to becoming a parent, matrescence, as we call it, that people just aren't taught about. And so, yes, there are things that tip over into like anxiety and depression or other things when you're struggling with breastfeeding and complications that we need to deal with. But a lot of it is just you have this intense pivotal moment in your life. You're extremely vulnerable at that time. Your hormones have dropped to postmenopausal level. Your brain is literally forming new connections and changing. You're sleep deprived. You're recovering from birth, which no matter how you gave birth, even if it was like yours, it was a beautiful home birth, like you had desired, no matter what, you still have to recover physically. You're also often the food source for this new little being that you're responsible for. So you're producing breast milk and your relationship with your partner, everyone around you, yourself, your own identity. I remember looking in the mirror and being like, who am I? Who is this person? What's going on? It felt like such an out of body experience, and no one prepares you for any of this. And so people don't talk about it, and they often just say, I'm fine, I'm great. Oh, the baby is such a good baby. I love my baby so much. They can't sit there with the parts of it that are, it can be beautiful and amazing, but it's also really hard. And sometimes you want to run away. And sometimes, you're like, I love my baby, but they're really annoying me right now. And I can't deal with this anymore. There're just so many things where it's this and this, and not only the beautiful, shiny things that we see in society and the narrative that we're supposed to feel.
Yes, and we're made to feel guilty
Mm.
if things aren't rosy,
Yeah.
right? It's like we're doing it wrong or there's something wrong because you have wanted this baby and now this baby is here. And then think about it also at the level of if people have been on a journey to get to this
Mm.
baby. If there's been a long struggle or a long time or a long journey to get to this baby, and now you're in this like penultimate moment
Mm.
and you're like, wow, I feel guilt
Yeah.
that things don't look or feel perfect. I feel shame. I
Mm.
feel like there's like I'm failing somehow
Right.
as a
Like, I'm not
mom.
cut out to be a mom, or maybe I'm
Yeah.
doing these wrong. Yeah, there's so much of that. And you touched on the fertility journey. I've worked with a lot of people who, when I see them at the beginning of pregnancy and I hear about their fertility journey, I know they're already a setup for having those conflicts and that anxiety and these kind of feeling like the emotions don't match up with what they should, and they often feel so much guilt because they work so hard to get this baby. And sometimes even from the beginning of pregnancy, they feel like they've already been dealing with pregnancy for so long because they've been watching what they eat and exercising and really restricting and taking care of themselves in a way to be prepared for this baby. And by the time they're pregnant, they're just like, oh my gosh, I just want to get back to normal. And so they even struggle with it from the beginning. Like, I feel this way, but I really wanted this pregnancy. Why do I feel this way? And so just making space for all of that and being like, it's okay. Like, you've put in months or years and all of this intense process into getting here. And so this pregnancy is going to feel really long. And then it's also okay when the baby comes to not just immediately fall in love with your baby and be like, motherhood is amazing. And it is just making space for all of these emotions and feelings would be so helpful for people's psyche so that they don't feel this sort of guilt and shame as they're stepping into motherhood or parenthood.
This conversation makes me think about our screening call that we did ahead of time. One of the things that Jessica mentioned about me when we were just kind of anecdotally talking about, like, what kinds of things could we talk about? We found that there are lots of things that we could talk about since we both are very passionate about this space. And she really surprised me when she started talking about the anxiety side of it when I was telling her that I had a journey, and anybody who's been following the show knows and has been along my journey with me to the birth of my son and through the birth of my son. It was an 8 years in the making kind of experience. And she was like, "Yeah, it totally makes sense that you are having a little bit of postpartum anxiety." And, I hadn't thought about, and I work in this space, right? This goes back to, I have all of this training and I still didn't expect that
Mhm.
this would be my lived experience. And I did not expect the postpartum anxiety that I experienced with my son. And I would press myself against the wall to go down the stairs holding him because I didn't trust anyone else to touch him. And I was afraid I would drop
Yeah.
him. And I
Yep.
could very, like, viscerally see that in my brain, and I was not prepared for that because I didn't have the experience of, I feel like I've been pregnant forever during my pregnancy. I actually felt like by the time I actually got pregnant, I felt like it flew and it went way too fast. But the anxiety after, it was like my
Yeah.
milk came in, my anxiety level shot through the roof,
Mhm.
and it was a struggle. Driving a car made me anxious for quite a
Mhm.
few months. Letting other people touch him, like, even now, I mean, I'm 8 months post, and I still, like, I can let other people hold him, but I feel like a tightening in my chest. It's not as bad as it was, but it
Yeah.
still feels weird.
You are still fresh on this journey. You are still in the early postpartum period. And it's something that we don't acknowledge as well. Like, postpartum is the whole first year, but really to get to like your solid baseline of hormones in your brain and biochemical changes, it's the first couple of years. And so these feelings of anxiety can come up at any point. And what you're describing, these intrusive thoughts, are one of the most common symptom of anxiety. And people often don't voice it because they think that others might interpret it as like they want to do harm to their baby. For instance, if they have scary thoughts of accidentally drowning their baby, or they'll stay away from the knives in the kitchen because they have scary visions of stabbing the baby. And it's horrifying to them. They would never do it, but they're afraid to voice these concerns that someone will take it as there's something wrong with you. And this is part of postpartum anxiety. There are other things where people have thoughts that are what we call mood congruent, where it makes sense to them and they have delusions or hallucinations. And that's a very different scary thing. But these intrusive thoughts, I've seen people all the time who will sit with their baby to go down the stairs so that they're not walking down the stairs. There's just so many different ways this can present. And that's one of the first thing I'm asking people when I'm talking to them postpartum is, Are you having any of these thoughts? When the baby goes to sleep, are you able to fall asleep? Or are you putting your hand on their chest every 5 minutes or walking in the room to making sure they're breathing, the temperature is okay? I did all of these things too. So
I feel
I'm
like you're
there with you.
describing
Yeah.
my first 5 months solid.
Yes.
I
Yes.
did this sitting
Yes.
on the stairs thing too, by the way. My
Mhm.
first few,
Mhm.
I didn't trust my legs
Yeah.
that they were strong enough and my core was strong
Yep.
enough to take the stairs 1 foot at a
Mhm.
time. And we graduated from on my butt with the baby against my chest. I would actually like put the baby
Mhm.
in a pack on my chest to
Yeah.
again make sure my arms weren't going to fail and I was going to drop him down the stairs. And I would like scoot on my butt down the stairs
Mhm.
because it felt safer to me. And then it was when I was
Huh.
standing, it was pressed against the wall. And then I would 2 feet, 1 foot, and then the other, and I'd be standing on the stair and I would like inch my way down the stairs that way. Oh, yeah, this is very real, folks.
It is. It is. Yeah. I mean, one of my big things was afraid I'd hit the baby's head on the door frame walking through the door. So I always had her in the center of my chest when I was walking through the door because I would just have these images of like hitting her head against the door frame.
Yeah.
But yeah, it's a lot. And there's also people can have intrusive thoughts about accidentally sexually abusing their child, and they can be afraid to change the diaper, afraid they'll touch them inappropriately. And can you imagine having these thoughts and they're so scary and they feel so bad, but being able to voice them to anybody? So many people keep these thoughts a secret and they'll either have somebody else change the baby's diaper or it's just a really tough experience for them to do it. We need to make this more of an acknowledged experience that this is very common. There's a lot of support and resources for it and help people feel that they can talk about this so they're not going through these intense experiences all alone and feeling guilty and feeling shameful about it.
Yeah, absolutely. And this is why, when we were talking, I was like, oh, we really have to talk about the advocacy side of this because I think that because we don't talk about how the mental health side of this can show up, there's been more public conversation, I feel like, in recent years around postpartum depression, a little less so around postpartum anxiety. I
Mhm.
don't see, even working in this space, a ton about postpartum psychosis, just so that listeners are kind of aware that there's different presentations of, like with my first postpartum, I didn't realize body dysmorphia was a
Mhm.
thing. And that whole looking in the mirror and not recognizing the face staring back at you, then how I felt about my body image and how like I was totally unprepared for how my body was going to be permanently changed afterwards. Like for some odd reason at nearly 30 years of age with my first child, I thought my stomach would just go back. I did not expect all the loose skin. The stretch marks didn't bother me, but it was like this loose skin that I had that I really thought would just kind of go back to normal. And it wasn't until my daughter was almost 5 years old, I saw this beautiful glossy coffee table book in a doctor's office and all black and white images of postpartum bodies. And I'm sitting in this waiting room and I just started to bawl. Now,
Mhm.
granted, my daughter's almost 14, so just to give you like timeline and how much awareness has really shifted and the advocacy piece has really shifted in roughly 15 years time, and I'm so grateful for it. But I started to bawl looking at this book. I was like, where was this book when I had my daughter? Because I'm like, look, my body actually does look normal. And I
Yeah.
didn't realize that. For
Yeah. And there's nothing wrong with you for feeling when you birthed your first child that it was going to look like it did before, because that was the image that we would see. And it's still the predominant image, this like, and there's even people selling stuff to, this is the exercise routine you should be doing. This is the diet you should have. These are the supplements you should take so you can bounce back and get your body back. And everybody's bodies are different before and after giving birth. And so some people will look a lot like they did before, but most of us, there are recognizable differences. And even those who look physically on the outside pretty similar to before, there's massive changes that went on inside your body physiologically and in your brain and in your hormones. So we just have to recognize and accept that and kind of toss away this societal narrative that like you should be back to who you were 6 weeks before, like nothing had happened, go back to work and be the same person you were before. It's just crazy to have these sort of ideas out there. It's unrealistic and it makes us feel terrible.
It really does. It really does. So, just talking about how people experience postpartum, what are
Mhm.
some of I'm going to call them mental health presentations because, I feel like you're far more qualified than I am to give like the actual names and connect the dots so that people who are listening, who are like, is what I'm experiencing normal or something that is common? We talked about a little bit about the anxiety side of it, but what other
Mhm.
kinds of symptoms do you find are quite common for people
Sure.
to experience postpartum?
Yeah. And I want to preface this by saying I'm on the board of an organization called Postpartum Support International, and they have amazing resources on their website. And some of them are tools for like symptoms checklist. So, especially if you're concerned, you can go on there, you can look at these common symptoms and use that to bring to your provider, your doula, your lactation consultant, your midwife or doctor, whomever can advocate for you to get you the support you need and say, this is what I'm experiencing. The first couple weeks postpartum, baby blues are almost universal. About 80 to 90% of people will experience them. And those are the early mood swings from the substantial hormone drop. After your placenta is out, your estrogen and progesterone drop to like menopause. And a lot of people actually have like night sweats and hot flashes, and they're like, oh my gosh, what's going on? Like, welcome to sudden menopause. These hormone changes will kind of level out some over time, but as long as you are breast or chest feeding, you will still have the low estrogen levels. And so you can still experience some of these symptoms. But anyway, those lead to mood changes that are typically rapid fluctuations where you're feeling fine one moment, you're tearful the next, you don't really know. You're like, this is where I'm like, I don't know why I'm crying. And then you can snap out of it pretty quickly. That resolves by 2 weeks. So if you're having a lot of symptoms of like tearfulness, crying a lot, not feeling like yourself anytime after the 2 week mark, and remember, postpartum goes up to the first year, then that is something else to look into. Postpartum depression, it can be like sadness, tearfulness, not enjoying things you used to enjoy, being in bed all the time, feeling disconnected or not wanting to engage with your baby. But it can also present as postpartum anger and rage, which a lot of people don't know, where you're just really, you have a very short fuse. You are snapping at your partner, you're more aggressive than you used to be. You might be yelling at your other kids, and you're just like, what is going on? And that can be a sign of postpartum depression. So you always
Wow.
want to look out for these things. Yeah. And a lot of people feel bad, and it's something that they're like, they don't discuss, but postpartum anger and rage is very common. And when you think like, if you're sleep deprived after having a baby, your emotional buffer is already gone. And so it's much easier to tip over into these sort of symptoms. For the anxiety, we talked about the intrusive thoughts. You can also feel very overwhelmed. Things that used to be easy tasks, like getting out of the house, seem to like be impossible or very hard to do. The hypervigilance, like we talked about some of that as well. These are very common, and a lot of that can also tip over into OCD, which is more common than people think. But when you're having these thoughts of like something scary happening to the baby, and you do certain compensatory behaviors or you avoid certain things because of that, and that's interfering with your life, that's postpartum OCD. And so, yeah, the treatments are similar to anxiety. There are therapists who specialize more in OCD treatment, but like medication wise, similar treatments to anxiety and depression. And then there are also birth trauma is really common. It's not as common to turn into PTSD, but symptoms of trauma postpartum affect a lot of people. About half of people or so have some symptoms of birth trauma. And you may have had, like you said, the most beautiful birth, but even that, it's how a person experienced something, not how it looked the outside. So I've seen people who really wanted to have an unmedicated vaginal birth. They had that experience, and then they're like, that was so traumatic. I didn't have control over my bodily functions. I felt like people were seeing me in this very vulnerable situation. So it doesn't matter the birth, but of course, there are things like complications that happen during birth and in the early postpartum period that can really lead to birth trauma. But you can also have something like an unscheduled C-section that happens, but feel really supported and seen and heard and cared for and safe. And then you don't get trauma. So it's really, trauma is in the eye of the beholder, and you never want to dismiss your trauma, which can appear in so many different ways to people. But if you're feeling triggered or having flashbacks or feeling like something is off, and this can also happen to your partners, your loved ones who were there with you during the event, reach out to your providers so you can get the right resources to process that. And then there are the more rare things. People can have bipolar disorder and they can tip over into mania postpartum, even if they never were diagnosed with bipolar. But sleep
Oh,
deprivation does a lot to us. And postpartum psychosis, which is rare but serious. And that is when there are the hallucinations or delusions, and it can be associated in rare, serious events with maternal suicide or infanticide, which is really sad and terrible. And so we want to make sure that we have like resources and support available for people and their partners to be able to recognize this and get help, because those are emergency situations.
wow.
It's a
So,
lot.
well, but it just goes to show, though, that the spectrum is so much broader than I think
Mhm.
most people realize.
Totally. Totally.
And because we have this bounce back culture idea, I
Mhm.
find quite often that, like, even in my own household, sorry, everybody, here we go. Even in my own household, it's been hard for some of my family members to have compassion for the fact that I just gave birth to a human. The pace of life didn't support the fact that I had to travel like in my first 3 months,
Yeah.
and I have found myself in a few situations where like the daily life demands in a very tender healing period, and even doing what I do where I did honor confinement period because I'm an East Asian medicine practitioner, and I did
Mhm.
do that 40 days of laying in. It
Mhm.
made a huge difference in my recovery, versus my previous birth. Even with nourishing myself properly, I did have help during that time frame. I did have an attentive group of people who made sure that I was replenishing and recalibrating the way that I needed to, that I still was expected to do the internal brain gymnastics for family household logistics. And
Mhm.
we need to pull a transcript for my son so he can play basketball. And I'm like, I just pushed a human out of my body 4 days ago. Like, can we hold on a second? Like, does this have to be done right now? And so I feel like sometimes I've heard from my clients where like they've tried to assert that boundary, and family goes, "Well, why is it that they don't want me to come visit?" And it's like,
Yeah.
"Well, hold on. It's not that they don't want you to come visit. It's that they're honoring the pace of what their life allows them physically, mentally, emotionally to handle in
Mhm.
this."
Yeah, that's so important. And it's so hard for people to do, whether it's your partner or friends or family. And this is often a time where people have to learn how to say no and set boundaries and ask for help, and not let guilt dictate what you do and do not do, because it can be very hard to say to a new grandparent, no, you can't come right now. But if you know that grandparent is just going to want to hold your baby and not help with anything, and you're going to be caring for them as well, then it might not be the right time for you. And so you have to work on getting comfortable with that, and even setting expectations beforehand. I talked to people, earlier in pregnancy about talking to their partners and their support system about expectations postpartum, and know that expectations might change, but there need to be boundaries. You need to be able to say, when I come home with the baby, I'm going to be resting and healing, and sleep is important for my body, and nourishing my body is important. And I'm not going to do anything else around the house. That is for everyone else to do. Because so many people who identify as female, or the, birthing person in the family, they're used to doing everything and not asking for help. And then everyone around them learns to rely on that. And so you really have to reset those expectations, and what you're talking about, the mental load, which is also not just the doing the activity, but keeping all of those checklists in your minds and doing all the steps to get to that completed activity. That is usually on the person who has just now given birth. And so it's really important to know this. And I also speak to a lot of people who may have had one child before, and they still did everything and like let their partner sleep all night and took care of the meals while their partner was at work and cleaned the house. And then they bring home the second child, or sometimes it's the third child. And then that's when they're falling apart, because they're like, this is untenable. I can't do this anymore. So really kind of working on that. And one of the couples therapists I spoke to for my book was really great. And she said that when she talks to couples, she'll sit them down and be like, what did dynamics look like in your house when you were growing up? Because when people are in that like sleep deprived, stressed out state, they tend to default to what they saw at home. And even for people who are more evolved and they're like feminists and they're modern, things tend to go back to what your parents modeled at home. And so we have to break those patterns.
Ooh, that's a really good point. I hadn't thought about that, but I can actually, just thinking about my two birthing experiences, I can see that in Technicolor. So this is actually a really beautiful lead into your book. If you could talk a little bit about your book and how it is, where people can get it, and how it is supporting this time in people's lives.
Sure. So my book is called Then Comes Baby, an honest conversation about birth, postpartum, and the complex transition to parenthood. And I wrote the book for birth parents because there are so many books about how to take care of your body during pregnancy, how to take care of your infant, but there's really not a lot about how to care for ourselves and prepare ourselves and set expectations for the things that might happen, that might go off course during birth and postpartum. And so I take a lot of it from my own experience as a mom, my experience as an OBGYN providing obstetric care and mental health care, and the common things that I hear that people were really struggling with and come to me and are crying when I'm asking them how they're feeling and how it's going, because they're like, I just never thought this could happen to me, or I didn't even know this existed. And so a lot of the work I'm doing is validating their emotions, telling them how they're not alone, helping them feel supported and getting the resources they need to work through it. But a lot of it is like, if they just had this knowledge beforehand, then they would have been set up to have less of those feelings of feeling shame and alone and like a failure, or that their body's a failure. So I just wanted to put that out there. And it's a very holistic book. And we cover the mental, emotional, physical, all of it. And I talked to a lot of experts for it in places that I wasn't an expert, like sex therapists, trauma therapists, postpartum trainers, pelvic PT and OT, all sorts of things that really kind of bring together and create a little cocoon around the birth person to say, like, if you had access to all of these wonderful people, what would be the advice they would be giving you during this time? So the book is available anywhere you buy your books. And I just hope it helps people feel less alone and more connected, and see that we all go through this birthing experience and never know what the journey is going to bring. There's a lot of things out of our control. And I know a lot of your listeners know, because they start with you from fertility or pregnancy loss. And so they've already had that like loss of the dream of everything's going to go a certain way. But I want to like carry that on through people through the postpartum period, so they feel seen and heard and have like a community space that is validating their experiences.
I love that's so incredibly important. A link to the book is going to be in the show notes. So if you or someone you know and love are welcoming a child into the world, or soon welcoming a child into the world, thinking about welcoming a child into the world, this is an incredible resource, one that I wish I had when I became a mom, one that I wish I had when I became a mom again. Because, like you said, until you're in it, you don't know what you don't know. And then once you're in it, you're like, now where do I go? And because you're so tired, the energy behind doing that research, like it's hard to sift through the forest and the trees. And sometimes it's hard to see that you're in it until you're looking at it with some time behind it. So this is such an incredible resource. So please go check out this book, share it with those that you love. It is a really important resource. If people are looking to get in touch with you, how can they find you?
Yeah, so I am on Instagram at Dr. Jessica Vernon, the same name for my website, Dr. Jessica Vernon. I also practice at ULA in New York, so you can find me through their website and reaching out to ULA. I'm not super active on social media all the time, but I promise if I see messages from people, I always respond because I never want anyone to feel alone in what they're going through.
I love that. Well, we have talked about doing several more episodes, so definitely make sure to subscribe and follow the show. Dr. Jessica Vernon will be joining us again for a couple of future episodes about very specific topics that I'm not seeing a lot of people do enough conversation around. So, thank you so much for joining us for today's episode.
Thank you. This was really lovely to get to speak to you again, Adrienne, and I look forward to talking to you and your community more in the future.
And until next time, everybody.
Thank you for joining me for another episode of Reproductive Rebel. Reproductive Rebel is recorded by certified peri-steam hydrotherapist and acutonics practitioner, herbalist, and Chinese nutritional therapist Adrienne Irizarry of Moon Essence LLC. If you are interested in setting up an appointment for one-on-one support, ordering from our store, or checking out our course offerings, visit our website at moonessence.life. Be sure to subscribe to our newsletter and get insider information on upcoming events and offerings. Join the conversation. Like and follow us at Moon Essence Me on Instagram, Facebook, or LinkedIn. Your voices make this program possible. Thank you all for your continued support.